let me just call my senior. This is one of the most overused lines that we see when people prepare for PLAB 2, UKMLA Part 2. Let me just call my senior. It's like this line is ingrained into people in scripts, for example, to say, basically, in every case, you need to say this. No, you don't, firstly. You're a foundation year 2 doctor. There are lots of things that you are perfectly capable of doing without calling a senior. However, if you are going to call a senior, what I would say is make sure you've thought a little bit or demonstrated that you've thought a little bit about who is the most likely person to come and help me in this situation. Let me give you an example. Say, for example, you're doing a role play case, PLAB 2 role play case, of somebody who is pushing you for an x-ray. Okay, you don't think they need an x-ray, but they're pushing you. Rather than saying, oh, let me call my senior who will just come and magically sort this all out for me, say, no, I really don't think that an x-ray is necessary, but I can see that you're really, really keen to get this. So why don't I have a chat with one of the radiology doctors? Let's see what their thoughts are about this. Can you see how by saying one of the radiology doctors, it shows that I've thought about who might add value to this. I've given my thinking first, but then I'm calling for additional help to try and help me with this situation. That's very different to somebody pushing you for an x-ray and you just say, oh, this is a bit difficult. Let me call my senior, they'll come and sort this all out for me. Can you see the difference? You need to demonstrate that as an F2 doctor or foundation year doctor, you can handle a situation, you can demonstrate what you think, you can make an assessment, you can put a proposed management plan in, but of course you might need somebody to come and get a bit of advice or add a bit of value to that situation. And that's where you can show that this person in particular might be very useful in this case, and I've thought about it, and that's why I'm going to them. So if you're doing your PLAB 2 roleplay, UKMLA CPSA roleplay practice in study groups tonight, and your brain is telling you, call a senior, call a senior, call a senior, number one, try and show that you've thought about it and you've got a plan proposed. But number two, say, let me think who might add value. Is it a radiology doctor who might add value? Is it a consultant cardiology doctor that might add value? Is it a pediatrician that might add value? And that shows a little bit of logic in the way you approach things. We're getting ready for our next academy batch starting in 8 days. So if you're coming to that batch, it's fully booked, it's sold out. We'll be seeing you very soon. Look forward to greeting you in the academy. Otherwise, look forward to meeting you in the academy in the future as well. If you're preparing for your PLAB 2 CPSA UKMLA Part 2 exam, I'm Dr. Aman Arora from Arora Medical Education, and we will see you very soon in the Arora Academy. Take care.